So my first case study we'll be focusing on is improving communication between providers and patients with limited English proficiency. So a little background on this case is a nurse was working in a walk-in medical center. This center happened to be in a predominantly Spanish-speaking neighborhood. The patient came in presenting symptoms of an ear infection. The nurse did her assessment, handed it off to the doctor. The physician came in, did his physical exam, and ended up prescribing amoxicillin to this patient to treat his ear infection. Later that night, the patient ended up going to the emergency room with an allergic reaction to the medication. When he was presented at the emergency room, a translator was given to him in his room to discuss the events from earlier in the day. The patient then stated that he did know of his allergy to the medication. He just was unaware that that's what he was being prescribed due to the lack of communication and the language barrier between him and the physician. So the lack of understanding his discharge methods led this patient to be hospitalized. So the focal problem of this case study would be the miscommunication between providers and LEP patients. And LEP stands for Limited English Proficiency. So communication can obviously lead to many destructive things within healthcare. Miscommunication can lead to serious medical missteps, increased utilization, increased cost due to hospital readmissions or readministering medication, and poor patient satisfaction. And this is especially true for minority groups in the United States. So possible solutions that could be done to ensure something like this does not happen again would be for the nurse to request financial support. And she's requesting this from the physicians who run the clinic. So what they would use the financial support for would be to hire bilingual employees, whether that's medical assistants or more nurses or a translator. That is crucial to the environment that they work in. With this proposed solution, negotiation would have to be done in order for patients to agree to fit this within their budget. So agreeing to maybe not hiring full-time employees, but part-time or per diem to start off to see how they fit into everything, eventually leading to full-time would be the most beneficial. Financial support could also be used with continuing education for employees and allowing employees to take basic Spanish-speaking courses in order to help them within their jobs since they work in a primarily Spanish-speaking neighborhood. Next, improved patient assessment would be crucial, and the nurse recommends doing this using visual aids. So using things such as a patient chart where patients rate their pain of 1 through 10 based on the smiley faces, 1 being no pain at all, 10 being the most you've ever experienced, things like that. Also showing pictures of specific body regions to have the patients point to a picture to maybe tell you where their pain is, would also be very beneficial. Next and lastly would be improving discharge delivery methods. This is crucial across the board in healthcare, but especially with these LEP patients. Focusing on things such as the teach back method would be crucial, and that's where patients could use a translator to teach back the treatment plan that was just explained to them. This will ensure proper information was received on the patient's end and will allow doctors to let them willingly go home knowing that they completely understand their discharge methods and everything that goes along with it. This would drastically improve patient outcomes, reduce readmission rates, and lower healthcare costs overall.